Your cat could be in significant pain right now, looking directly at you, while still acting mostly normal. It is a surprising reality that many veterinarians encounter on a regular basis. Cats are incredibly skilled at hiding discomfort. They are biologically wired to mask weakness, which means that by the time an owner clearly notices something is wrong, the problem may already be advanced. Welcome to Cat Care Academy. Today we are revealing 5 silent signs your cat may be in pain that many owners overlook until the condition becomes serious. But before we explore the first sign, take a moment to think about where your cat is sleeping right now. The spot they chose might actually provide an important clue. We will come back to that in just a moment. To understand why cats often hide their pain, we need to look at their evolutionary history. In the wild, cats are highly effective predators, but they are also vulnerable to larger animals. Showing obvious weakness, such as limping, vocalizing in pain, or appearing physically impaired, could attract the attention of predators. Even though your living room is safe, your cat's brain is still influenced by these ancient survival instincts. Veterinary researchers have studied this behavior for many years, and evidence shows that cats often suppress visible pain responses more effectively than many other domestic animals. Stress hormones, such as adrenaline, can temporarily mask discomfort, allowing a cat to appear relatively normal even when something is wrong internally. Are you ready to rethink what the litter box might be telling you? Because sign number 1 has caused many cats to be misunderstood for behavioral problems, when the underlying issue was actually medical. Sign number 1 is missing the litter box. You might assume your cat is acting out, feeling stressed, or reacting to a change in routine. However, entering and exiting a typical litter box requires flexibility in the hips, knees, and spine. If your cat is dealing with arthritis, joint inflammation, or a painful urinary tract condition, stepping over that rigid plastic edge can be uncomfortable. Over time, the cat may begin associating the litter box with discomfort. As a result, they may look for softer or easier places such as a pile of laundry, a bath mat, or a carpeted corner. In many cases, this behavior is not defiance or revenge. It may simply be an attempt to avoid pain. Speaking of hidden signals, what if one of the sounds you associate most with a happy cat could sometimes appear in other situations as well? Sign number 2 is purring in unusual situations. Most people learn early in life that purring means a cat is content. While that is often true, veterinary behavior studies have shown that cats may also purr when they are stressed, frightened, or experiencing discomfort. Researchers believe that the low-frequency vibration of purring may have physiological benefits, possibly helping with relaxation or tissue recovery. However, the exact medical effects are still being studied. If a cat is hiding away from the family, remaining unusually still, and purring continuously in isolation, it may be using purring as a way to self-soothe rather than expressing happiness. Sign number 3 is a sudden change in grooming habits. Cats are known for their meticulous grooming behavior. They often spend a large portion of their waking hours cleaning their fur to stay hygienic and odor-free. When a cat suddenly stops grooming areas like the lower back or the base of the tail, the fur in those regions may begin to look greasy, clumped, or unkempt. One common reason is discomfort when twisting their body to reach those areas. Pain in the spine, hips, or joints can make that movement difficult. On the other hand, some cats do the opposite and begin over-grooming a specific location. Repeated licking in one spot can lead to hair loss or irritated skin. In some cases, this may indicate discomfort or inflammation in the tissues or joints beneath that area. Take a moment to observe your cat's posture right now. Are they stretched out comfortably, or are they sitting in a slightly tense position? This subtle detail can sometimes provide valuable information. Sign number 4 is a tense, crouched posture. Many people are familiar with the relaxed loaf position, where a cat tucks its paws neatly beneath the body. However, A cat experiencing abdominal or joint discomfort may hold a similar posture with subtle but important differences. The cat may lean forward slightly, keep the belly lifted just above the ground, and maintain a stiff or guarded body position. The back may appear somewhat arched, and the muscles around the face may seem tense. This posture can act as a protective stance, allowing the cat to shield sensitive areas of the body. Now we move to one of the more fascinating developments in modern feline pain assessment. Have you ever noticed subtle changes in your cat's facial expression? Sign number 5 involves what researchers call the Feline Grimace Scale. This scientifically developed assessment tool helps veterinarians evaluate pain by observing small changes in facial features. When a cat is uncomfortable, the position of the ears, eyes, whiskers, and muzzle can change in recognizable ways. The ears may rotate outward slightly. The eyes may appear partially closed or squinted even when the cat is awake. The whiskers may become more rigid and point slightly forward instead of resting loosely to the sides. The muzzle can appear more tense than usual. When several of these facial indicators appear together, it may suggest that the cat is experiencing pain and should be evaluated by a veterinarian. If you begin noticing these signs, your first instinct may be to help your cat immediately. However, there is an important mistake many well-meaning owners unintentionally make in these situations. Never give your cat medication from your personal medicine cabinet. Many drugs that are safe for humans can be extremely dangerous for cats. Even small amounts of common pain relievers, such as acetaminophen or ibuprofen, can cause severe toxicity in felines. These medications may lead to liver damage, red blood cell problems, and other life-threatening complications. In addition, products like menthol creams, essential oil rubs, or joint supplements designed for dogs may also be unsafe for cats. Feline metabolism processes many compounds differently, and certain substances can quickly become harmful. You might be wondering whether there is anything helpful you can safely do at home while arranging a veterinary visit. In some cases, small environmental adjustments can make your cat more comfortable. One useful step is reducing the need for jumping or climbing. Consider switching to a lower-sided litter box or creating a shallow entry point so your cat can walk in easily. Pet ramps or small stairs can help them reach favorite resting spots, such as a couch or window perch, without strain. Placing food and water bowls at a comfortable height may also reduce neck and joint pressure during meals. Another helpful step is documenting what you observe. When cats travel to a veterinary clinic, the unfamiliar environment can cause stress and elevated adrenaline levels. As a result, some symptoms may temporarily disappear during the exam. Recording short videos of unusual behaviors at home, such as limping, unusual posture, or facial expressions, can provide valuable information for your veterinarian and help them make a more accurate assessment. For long-term health, your veterinarian may recommend dietary adjustments or targeted supplements depending on the underlying cause. Some joint support formulas contain ingredients such as glucosamine and chondroitin, which have been studied for their potential to support joint health. Marine-based omega fatty acids may also help reduce inflammation in some cases. However, these decisions should always be guided by a qualified veterinary professional. Diagnostic tools such as physical exams, laboratory tests, or imaging like X-rays are often necessary to identify the true source of pain and determine the safest treatment plan. Let us quickly review the key warning signs. Pay attention to litter box avoidance, unusual purring in isolation, changes in grooming habits, tense crouched posture, and facial expression changes such as ear rotation or whisker position. Remember that human medications are unsafe for cats, and documenting behavior at home can help your veterinarian better understand what your pet is experiencing. If this video helped you better understand your feline companion, consider subscribing to Cat Care Academy. We focus on practical, research-informed tips that help cat owners support the long-term health and well-being of their pets. And now, we would love to hear from you. Have you ever noticed a subtle clue that revealed your cat was injured or uncomfortable? Share your experience in the comments so other cat owners can learn from your story. And we will see you in the next video.